Yat and welcome to 4 Directions of Wellness. I'm Roberta Diswood. Twobahanischle, Sisakani Bashichin, Nakaidinet Dashiche, Hanani Dashanelle. In 2014, Northern Navajo Medical Center became a baby-friendly hospital. Today we will learn what that means and how it benefits moms and families. We have 2 guests. Antoinette Kleiner is a lactation consultant at Northern Navajo Medical Center, and Angelina Smith is a lactation consultant with Public Health Nursing. Thank you, ladies, for being here. Antoinette, go ahead and introduce yourself.
Hello. Thanks for having us. My name's Antoinette Kleiner. I am a nurse for 20 years and a mother and a grandmother, and I've been here for 16 years, most recently as the lactation consultant for Shiprock Service Unit. In my culture, which is Guam, the Chamorro people also identify ourselves by clan, and so my mother's clan is called Dicta, which is known for their strength and their warrior characteristics. And then my father's clan is called Doni, which is our word for hot pepper.
Well, thank you, Antoinette, for being here. And Angie, if you want to introduce yourself.
I'm Angelina Smith, and I work for under Public Health Nursing. I've been a nurse for 33 years, and my clan is Oke, and Ashihe is my father's side. And I've been working with a lactation consultant going on 18 years.
Well, I want to thank you guys both for being here. Why is it important for a hospital to be recognized as a baby-friendly hospital?
Well, baby-friendly is a really prestigious designation. It's an accreditation that shows people that our hospital has really worked hard to create the safest start for all babies. So we really work to provide the gold standard of breastfeeding support and care here at our hospital.
Okay. And are there certain steps or anything to obtain this title?
Yes, it's a pretty rigorous designation. It's one that only about 1 in 4 hospitals in our country today actually hold. When we started the program back in 2014, only 1 out of 9 babies were actually born in a baby-friendly hospital. You really need to go through and evaluate your program and create processes and practices that help families really get off to the healthiest start. So we go through lots and lots of policy development and training for our staff, as well as our families. We work hard on prenatal education, and then supporting them through their delivery with hands-on support, things like experiencing skin to skin in a brand new way from past generations, keeping moms and babies together 24/7 so that they can learn and learn to trust and bond with each other, and providing them lots and lots of resources and available assistance along the way. So we work hard throughout the hospital to provide a continuity of care that's unmatched, really, from prenatal through delivery, postpartum, and back out into the community. And I find that that's really been our strength for maintaining this designation.
Okay. And how does being baby-friendly benefit? You talked a little bit about it, but how does it benefit the mom and the child?
Well, there's so many things that it helps. From a mother and a grandmother standpoint, it really, for me, the biggest thing is connecting them back to their families. And I find that, you know, what I've learned from the elders here is that when we had that disconnect, when we experienced that disconnect during what we call the formula generation, the formula era, we really lost a lot of bonding and connection with our children. So as a grandmother, for me, that's the most important thing. It helps their health, it helps the mother's health, it keeps everybody, you know, more strong and ready to help us make a better future for all of us. And there's just so many things from cancer to diabetes to asthma and allergies that it helps our children avoid if we breastfeed them for the first 6 months of life.
And not only that, because since our community is focusing more on preventing obesity and diabetes, and that's one way making the best choice for your baby, and it's your mother feeding their own child. It's a big prevention. That's a good start.
So do you guys offer any sort of class or anything that really goes into what to do?
Yes, we start prenatally, and truly a lot of the work is done in every point of contact here in our hospital. So wherever a mother is receiving her care, whether she is here in the hospital at our women's health clinic, or she's receiving care through our group prenatal programs, or in our family medicine clinic, or even out at our satellite and field clinics, families are receiving education at that prenatal visit. So we start there. We reinforce that with childbirth tours. We have consults that happen for high-risk patients if they have a need to start seeing Angie or I prior to their delivery. We start working then, and then Angie gets referrals, and I'll let you talk about that, so that we make sure we meet that need wherever it is.
As a public health nurse, and plus all the other nurses that there's about 12 of us, I think, we're all trained. And I take care of all the advanced care in breastfeeding, like engorgement or any other complication. So if you have a mother that lives outside of our facility and comes back, I'm the one that gets that referral, or Anthony and I consult, and we help that mothers in the home. So all our public health nurses do the same thing. But if they need more special needs, then they come to me for that referral. And our providers in the hospital know the same thing too. So.
Now that's really good to hear. So what happens when a mom goes home with her baby, like especially from a baby-friendly hospital?
What happens from a baby-friendly hospital that stands out from hospitals that are not baby-friendly is that community effort. So all of the families who deliver here get access to a public health nurse referral that is very important and oftentimes vital to being able to see them. We also have a wide variety of community resources all across the area and even nationally that they're able to access. And our pediatricians regularly schedule the baby for a follow-up visit within about 48 hours of going home, so that we have a chance again to make sure feeding is going well, that the baby is doing well, that the mommy feels like she's doing very well with her breastfeeding techniques.
So once we get a referral as public health nurses, what I do with mine is I go and continue that same standard of care in the home, making sure that they stay put, which is rooming in. They stay in the house so they get to know their baby, okay? And help them in a home environment, how to help that mom to get comfortable with her own environment so she'll do better of providing breastfeeding to her baby.
And then, as I know, when mom goes home, always the biggest thing people are starting to think about is work. And how do you guys help to address that?
We spend a lot of time and effort, which is wonderful, because from our colleagues in other locations, we have found that they don't provide the service we do. We actually help moms navigate requesting an electric breast pump for return to work, and to have that paid for by her insurance company. Many times that workload is actually put on the patient. Here's a prescription from your doctor, and you have to go and figure out what to do with it. We don't do that here. We actually provide that service for our families. We've got some coworkers up in the pediatric clinic who also help us facilitate that, so that we can help moms start off with a good quality, insurance-paid electric breast pump, and teach her how to use that and prepare for going back to work so she can continue breastfeeding her baby.
And furthermore, with what we do in the home, if I have a mother that has concern and her employer probably doesn't know much about the laws, so we have a nice brochure that we can give her, or even give her contact numbers, or even go there myself to the employer and talk to them about what kind of setup they can, how to handle that working mom to continue pumping or even nursing her baby. So.
And what final advice would you give expecting mothers who are, planning to have children? What do you guys?
Well, I always feel like knowledge is power, but power is limited if there's a lot of barriers around a mom. So I really want moms and dads and families to talk about it together. Oftentimes, families grew up breastfeeding, but it wasn't necessarily something that was discussed. So talking to the family, making sure everybody understands that mom's intention is to breastfeed and what she may need from them to help stay strong with that. Because even though it's natural, it's not always easy. And when you have your family wisdom around to provide support for you, it makes it a little bit easier.
Okay. Yeah. How about you, Angie?
I think what I really like for the community, since working in Shiprock for such a long time, I used to see mothers nursing back in the 60s and the 70s. And I would like to have that community, that norm, that mothers choose to breastfeed their babies. And I don't think we ever had that many illnesses when the mothers all breastfed their babies. And it's that big prevention, once again, to prevent diabetes and obesity and other illnesses.
Okay. Well, I want to thank you guys both for being here. This has been 4 Directions of Wellness. Hug on it.